Hi, I'm Dr. Eric Millstein. I specialize in sports medicine, knee and shoulder surgery, and today we're going to talk about meniscus tears. So the knee is a hinge joint that has cartilage like most of our joints. Because the bone up top, called the femur, is curved and the bone down below, called the tibia, is flat, we have a meniscus. That serves like a shock absorber or cushion in the knee. Many people refer to the meniscus as cartilage, and while it's not exactly like the cartilage that lines the end of our bones, it is a type of cartilage and often called this. When we tear the meniscus, that causes pain, clicking, catching, and a feeling of instability of the knee. This is a very common injury that all orthopedic surgeons see and treat, and one of the most common things that I personally see and treat. Unfortunately, the meniscus is not a well vascularized structure, meaning there's not much blood supply to it. So only the peripheral 1/3, meaning the outer 1/3 of this C-shaped structure, gets blood supply. The importance of that is that once the meniscus tears, it has a very difficult time healing. So for that reason, when the meniscus tears and causes pain, and that pain usually persists, we often recommend arthroscopic surgery to trim out the torn piece. I certainly believe in trying non-surgical methods first. Sometimes we'll try rehabilitation, anti-inflammatory medications, or even a cortisone injection. But when those either don't work, or the pain is significant enough and your lifestyle is affected enough by the meniscus tear, then arthroscopic surgery is usually the best treatment. While many people call this a meniscus repair, typically we're not repairing the meniscus. As I mentioned, we're cutting out the torn piece. Most patients often look at me in alarm at that point and say, well, doc, you just told me how important the meniscus is. Why are we going to cut it out? Now, if there is some risk of further injury to the knee down the road, that risk is actually minimized by removing the torn piece so it doesn't get caught and cause pain. I often use the analogy of a pebble in the bottom of your shoe. The only way to stop that from hurting is to take the pebble out. Fortunately, arthroscopic meniscus surgery is one of the most successful things that we do. It is a minimally invasive surgery that takes about an hour. Patients go home the same day and are often walking without pain pills or crutches within 2 to 3 days. This allows for a return to sports or high-level activities after about a month, and most people find that 2 or 3 months they're back at their previous activity level and performing at work or in the playing field at the level they would like to be.